And for more, I'm now joined by infectious disease specialist Dr. Isaac Bogoch. He is also a member of Ontario's COVID-19 vaccine distribution task force, and he joins me from Toronto. Dr. Bogoch, good to see you this morning.
Hey, good morning, Andrea.
All right, so I want to start with the biggest news here in Ontario. The province has moved into step 3 of reopening. Cases are down and vaccinations are up, even though they're slowing a little bit. In your opinion, are we ready for this stage 3?
We certainly are. I mean, it's obviously it's been a long wait. I know that there's many people who have been and businesses also as well waiting for this moment. Cases are down, hospitals are decompressed. We've got a significant proportion of our population vaccinated. We are ready for this. I think the other key point here that we can't forget is that, there still are a lot of unvaccinated people, even though we have significant rates of vaccination, that this virus has not gone away, and that people who are not vaccinated are still at risk. But I still think it's okay to move forward. For now, we just have to be careful and look to see what happens with cases and hospitalizations as we move forward.
And I know a lot of people are excited to get back to quote-unquote normal life, and everybody's ready to get back into restaurants and go into the movies and stuff. But should people be extra cautious as we are getting back to normal? Are there certain activities where you should still, have a mask with you or socially distance?
I think so. I really do. A lot of it depends on the person as well. We know not everybody will mount the same degree of an immune response to these vaccines. We know older individuals and people with compromised immune systems just don't have the same response. And even if they're vaccinated, they have some protection, but not as much protection. And of course, the same goes for people that live with others that might be vulnerable to this virus. So the vaccines are fantastic, but they're not perfect. I think people should still consider, of course, putting a mask on if you're going into an indoor setting, especially one that's crowded, enclosed or confined, where the circulation of air isn't as good. That should still be a very strong consideration for many people.
And I know we're optimistic about going into this next step, but what kind of metrics would you be concerned about that might prompt us to backpedal on some of these restrictions that are being lifted?
Well, we don't need a crystal ball. You can look to see exactly what's happening in other countries that have lifted restrictions. Many of those are European countries, and you see cases rise actually kind of quickly when many restrictions are lifted. And of course, that shouldn't come to anyone's surprise. It's a very transmissible virus, and it preys on the unvaccinated. And even though we have a significant proportion of our population with a first dose and a rapidly rising proportion with the second dose, there's still millions of people, including children, who are unvaccinated. And you just can't get surprised when a very contagious virus starts to infect unvaccinated people. So we will see a rise. It's going to happen. And sadly, we will see some hospitalizations associated with that. This will be predominantly, but not overwhelmingly, but still, it will be predominantly, in the unvaccinated.
All right. Well, Ontario's Science Advisory Table released some data this morning showing that vaccination rates among people 80 years and older may have plateaued. So why do you think this is happening? Is it accessibility? Maybe they don't have access to, technology to sign up for those vaccines. What's the problem?
Right. So the first point is that a very high proportion of people over the age of 80 have been vaccinated, but not everybody. And I think it's important to scratch the surface here and look at what are the barriers here? Like how can we get that remaining small percentage? There may be language barriers, there may be mobility barriers, there may be technology barriers. And if we really want to go and push that final mile, we really have to explore that in depth, because those are the most vulnerable people, right? That means going door to door, offering vaccines, lowering any possible barrier, really chatting with people, meeting them where they live, and really trying to push that number higher. Because, sadly, we know that those individuals, if they do get infected, have the highest probability of hospitalization and death.
Yeah, and that's the worry. All right. Well, Ottawa is also talking about allowing fully vaccinated Americans into Canada as soon as next month. But the Delta variant is causing a surge in cases south of the border. So is there a danger from opening ourselves up to travel, especially from our neighbors to the south?
Right. So on the one hand, we know the risk of a fully vaccinated individual is low. Yep, they can still get this infection. It's just less likely. Yep, they can still transmit this infection. It's also less likely. But if fully vaccinated individuals, the risk is very low. I think the key thing here is, how do you confirm that somebody is fully vaccinated? So this will be more of an issue of documentation, but theoretically allowing fully vaccinated people to travel into the country shouldn't be an issue. The key here is at the border, can you ensure that people who say they're fully vaccinated are actually fully vaccinated.
That's going to be the big question. All right, well, thank you so much for that update from Toronto. That is infectious disease specialist Dr. Isaac Bogoch. Thanks again for your time this morning.